Hello, how are you?
Good, how are you?
Good. My name is Olivia. I'm going to be doing your examination today. Could you just tell me your full name and date of birth, please?
My name is Brandy Meredith, and my date of birth is April 11th, 1993.
Okay. So, 22-year-old female who appears to be her stated age. And do you mind if I take notes during this exam?
No.
Okay, perfect. All right. So I'm just going to assess your level of consciousness. Can you just tell me today's date?
It's November 22nd, 2015.
Okay. And can you just tell me where you are?
I'm in the exam room.
All right. And why are you here today?
I'm here for a physical exam.
Okay, perfect. So it seems that Brandy is awake, alert, oriented ×3. She's cooperative and shows no signs of distress. Her skin is pink with no signs of cyanosis, and she appears well nourished and developed. Her posture and position is comfortable, and she's sitting erect. She has no obvious physical deformities, as I can see. Can you just get up for me and walk across the room, please,
Sure.
Randy? And her gait is regular, and she doesn't exhibit any involuntary movements. She has no range of motion difficulties, and she moves with ease. Brandy's facial expressions are appropriate for the situation, and her speech articulation is clear, no deformities with that. She speaks fluent English, and she responds appropriately to all questions. So, she is able to hear stated questions with no difficulty. She appears clean and well groomed. Now it's just time to assess your hair, skin, and nails. So, can you please just hold out your hand for me? Okay, her skin is pink, dry, and intact. She has 10 fingers with 10 fingernails. She has no clubbing or deformities. And I'm just going to check the capillary refill. All right, and her capillary refill is less than 3 seconds, which is perfectly normal. Her skin seems to be normal for her ethnicity, and her hands are warm and smooth to the touch. Her skin returns promptly when I do a skin turgor test on her. All right, good. And I'm just going to assess your head and face now.
Okay.
So, just going to palpate your scalp and your hair and look at your head here. Okay, everything seems to be normal with that. Do you have any tenderness when I did that to you?
Nope.
Okay. Her head is normal with no lumps or masses. Her hair seems suitable for her age. It's evenly dispersed, and there's no flakes or scabs or anything in there when I looked at that. Now I'm going to check cranial nerve 7. Do you want to stand up for me so you're at eye level? Perfect. And now for this, I'm just going to ask you to smile and frown and show your teeth. And if you just close your eyes tightly for me and open them and raise your eyebrows. All right, now puff out your cheeks. And I'm just going to get the air out of there for you. All right, so I was able to push the air right out of her mouth with no problem. Okay, now I'm going to palpate your sinuses. All right, so sorry, my hands are cold. All right, her sinuses seem to be fine. Did that produce any tenderness for you when I did that?
Nope.
Okay. All right, so now I'm going to assess your eye. I will assess cranial nerve number 2 with the confrontation test.
Okay.
Can you just cover your left eye for me and tell me when you see the pen come into vision?
No.
Okay.
No.
All right, now cover your right eye for me and tell me when the pen comes into vision.
No.
All right, and then again.
No.
Okay, perfect. So that assesses cranial nerve number 2, which seems to be intact. Her visual fields are intact. Now I'm going to assess cranial nerves 3, 4, and 6 by using the cardinal positions of gaze. All right, so just follow my finger with your eyes and not your head. All right, good. those cranial nerves are intact and everything's fine with that. So I'm just gonna inspect your external eye. Let me just pen light here so I can see better. All right, it seems that your eyelashes and your eyebrows are intact and there's nothing wrong with that. Now I'm just gonna inspect the internal eyes, and I'm just gonna pull your eyelid down and look at your conjunctiva. Sorry, my hand, I can feel it. And the conjunctiva is normal color, pink. The sclera is white with no lesions. I'm gonna do the pupillary reflex on your eyes. Okay. Perfect. So her pupils responded to the light, which are they presented as equal, round, and reactive to light accommodation. Now I'm going to inspect the ears. All right, I see no lesions or masses. Do you feel any tenderness when I touch them? Okay, good. Now I'm going to assess cranial nerve number 8, which is assessing voice. So I'm going to cover one ear and whisper a word into the other.
Lamb.
Okay.
Dog.
Okay, perfect. Now I'm going to assess the nose. Looking at it, it looks symmetrical and intact with no deformities. I'm just going to close one nostril and ask you to breathe in with the other. All right, and do the same on the other side. Perfect. The nares are present, and it seems that she has no issues with breathing. Okay, now I'm going to do the mouth and the throat. Her lips look pink and intact, which is normal. Her mucous membranes, can you just open your mouth for me? They are pink and intact. I'm gonna assess her mucus, her buccal mucosa. If you could just open your mouth for me. All right, I'm just gonna pull down your lip and look on the inside of that. Okay, everything looks pink and moist and intact, which is normal. Now, can you just look? Can you just place your tongue at the top of your mouth for me? Okay. And I'm just gonna hold the tongue blade to your tongue and look at your tonsils. Okay. So just open your mouth for me. Okay. Her tonsils were removed when she was 18 years old, so they aren't there, which is normal for some people. I'm going to assess cranial nerve number 9 by having Randy stick out her tongue and say ah, so I can see what it's testing. Okay. So her uvula moves up and down when she says ah, which is what it's supposed to do. Now I'm going to assess cranial nerve number 10 by activating the gag reflex. I'm just going to assess cranial nerve number 12 now. I just need you to stick out your tongue and move it from left to right. Okay, perfect. All right, so her tongue protrudes out to midline with no tremors or anything like that. All right, now I'm going to inspect the neck. You can have a seat, all right, so let me just take a look at your neck. Her neck is symmetric with no visible masses, and her skin seems to be dry, warm to the touch, and intact. I'm going to palpate her cervical lymph nodes. And there seems to be no masses. They seem to be symmetric. And now I'm going to palpate her carotid pulse. Okay. Right, and it is a grading of 2+ and equal bilaterally. Now I'm going to listen to her carotid artery. I'm going to do this with the bell of my stethoscope. So everything seemed normal with that. There were no bruits present. That's her trachea, which is midline. And I'm going to assess now for jugular distension. Now I'm just going to ask you to lean back a little bit. Normally I would elevate the head of the bed to 30 degrees. I'm just going to have you turn to the left for me. And I'm going to shine the light. Okay, now turn to the right. All right, and there seems to be no jugular vein distension. Now I'm going to assess cranial nerve number 11. Can you put your chin to your chest, please? All right, and turn your head from left to right, and shrug your shoulders for me. All right, perfect. So that seems like cranial nerve number 11 is intact. Her neck seems normal with full range of motion. And all right, now I'm just gonna inspect the upper extremities. Can you just hold out your arms for me? Okay, her arms seem symmetrical and normal bilaterally. Hair distribution is normal for her age. Can you just bend your arm? I'm just gonna try to pull it towards me. All right. All right. Now put your hands like this and try to push out on my hands. Okay. Now try to push my hands in. Perfect. She has full range of motion with no weakness. And check your brachial pulse. Now I'm doing the radial pulse. All right, and they both seem to be a grading of 2+ and equal bilateral. Now I'm going to check her chest and lungs posteriorly and anteriorly. Normally I would do this bare skin. All right, so if you could just stand up for me, I'm just going to check your diameter here. All right, so then it seems that the anterior posterior diameter is less than the transverse diameter, which is normal. Her chest is symmetrical. I'm just gonna test your chest expansion. Just breathe it in for me. And one more. All right. So chest expansion is symmetrical on both sides. Now I'm going to palpate the posterior and lateral chest. And now on the lateral side. Does that give you any tenderness? Nope. Can I do that? Okay. So can you let your head hang and your arms to the side? Just going to palpate your spine. All right. It seems that your spine's processes are. Did that give you any tenderness when I did that? Nope. Okay, so she just denies any coastal vertebral angle tenderness. Now I'm going to listen to the vesicular and vesicular sounds, which is on the back. Deep breath. All right, so her lungs sound clear with no rails or bronchi present. Now I'm going to listen to the bronchial sounds. Can you just face me? And again, all lung sounds are clear with no bronchi or rails present. I'm going to count your respirations. You can have a seat. Normally, I wouldn't tell the patient that I was counting the respirations, but I'm going to do so anyway. All right. So I got a count of 7 for 30 seconds, and you just multiply that times 2, which gives you 14 per minute. To palpate her chest for any lumps. I don't know if it's right or not. Alright. Did you feel any pain with that?
Nope.
Okay. Patient denies any tenderness, and there are no visible lumps. Alright, now I'm going to assess the heart. With assessing the heart, I'm just going to place 4 fingers over the apex of the heart. And there's no pulsations, which is normal. Now I'm going to take the apical pulse rate and rhythm. Alright, so I got, counting for 30 seconds, I got 32, which you multiply that times 2, which would be 64 beats per minute, which is a normal range. Now I'm going to listen to the valves of the heart, starting with the second right intercostal for the aortic, and moving right over to the left intercostal for the pulmonic, and now moving down to the left lower sternal border for the tricuspid, and then going farther over to the left midclavicular for the mitral. Alright. There are no extra sounds, and her heart sounds seem normal, and there's no murmurs or anything like that. Now I'm going to inspect the abdomen. Her abdomen seems round, normal, and I'm just going to assess it. And her skin's intact, pink, warm, dry, all the normal things. And it's symmetric. There's no discolorations or pulsations around the umbilicus. Now I am going to start in the right lower quadrant by listening to the vowel sounds. Alright, we have vowel sounds in all 4 quadrants. I'm gonna assess the lower extremities by palpating Brandy's femoral pulse.
I'm really good in there.
Really getting in there. Alright, so her femoral pulse is 2+, which is equal bilaterally. Now I'm just going to palpate her inguinal nodes. Alright, so the lymph nodes there are palpable, and did that cause you, non-palpable, and did that cause you any tenderness?
Nope.
Okay, good. Now I'm just going to ask you to stand up for me. Normally the patient would have a gown on, so the lower legs are exposed, but that's okay. Your legs look normal and symmetrical. I'm just going to take a look at your legs here for the skin. All right. Okay. All right, the skin is dry, intact. It feels warm on each side. The legs were shaved, so I can't tell about the hair distribution. Now I'm going to palpate the popliteal, posterior tibial, and pedal pulses. You can sit back down for me. All right, put your leg up here. I'm just going to take your sock off for you.
Go for it.
All right, good. Okay. Alright, so all pulses are grading of 2+ and equal bilaterally. Now I'm going to assess for edema on the lower legs here, just by pressing in. And there seems to be no edema. There's no indentation in the skin. Right. The same goes for that leg. The feet are warm with no edema present. I'm just gonna check the capillary refill. Sorry. All right. And capillary refill is less than 3 seconds. Now I'm just gonna ask you to bend your knees. All right. And rotate your ankles for me. Great. Now if you can just flex and point your foot up against my hand, push. Perfect. Right. And again. Perfect. She has full range of motion with no limitations in lower extremities. Now I'm just gonna assess her neurological system by identifying sensation in the face, arms, hands, legs, and feet. Just tell me when you feel it. Close your eyes for me and tell me when you feel a cotton ball.
No.
All right, and extend your arms for me.
No.
No.
No. No. No.
Okay.
No. No.
And just show on your feet really quick.
No. No.
Okay, perfect. All right, and she's able to feel all sensations. Now I'm gonna assess the Babinski reflex. Just how your foot. All right, the normal Babinski reflex. It is negative, and her toes curled over. Now I'm going to do a very limited mini mental exam. We assessed earlier that she was alert, awake, and oriented, but I'm just going to go a little bit further. I'm just going to tell you 3 words, and can you just remember them for me? Dog, plant, and chair. Now I'm going to show you 2 familiar objects, which you should know. Do you know what this is?
Pen.
All right. And do you know what this is?
A stethoscope.
All right. Now can you tell me those 3 words that I asked you to remember?
Dog, chair, and plant.
Okay, perfect. Brandy passed the mini mental exam. Now I'm going to assess the musculoskeletal system. Can you please walk across the room for me, heel to toe? All right, you can come back now. All right, and can you just bend at the knees for me? Now touch your toes. Lean forward, backwards, and side to side. All right, and the gait was smooth and fluid. She has no weakness and full range of motion. And now this concludes my assessment. Thank you for your time, Brandy.
Anytime, Liv.